More than 7,000 chemicals are released every time you light a cigarette. Unsurprisingly, smoking is one of the leading causes of early death worldwide. There are 1.3 billion active smokers in the world. What happens when one of them quits smoking? During the first 20 minutes, your blood pressure and heart rate return to normal. Nicotine releases adrenaline and norepinephrine, which increase heart rate and constrict blood vessels. By the way, this is why smokers get cold. Now your hands and feet have regained their normal temperature. 2 hours later, nicotine deficiency will begin to manifest itself in sudden mood swings, lethargy, and even sleep disorders, since nicotine stimulates an increased release of dopamine. This is how the body will react to its sudden shortage. 8 hours after quitting smoking, the body is cleared of carbon monoxide and the oxygen level in the blood rises to normal. Carbon monoxide and oxygen compete with each other, trying to combine with hemoglobin, and this puts a strain on the cardiovascular system. There is more room for oxygen without foreign substances. However, in smokers with long-term exposure to carbon monoxide, it causes an increase in red blood cells. The blood becomes thicker, which leads to increased blood pressure and increases the risk of blood clots. After 24 hours, strangely enough, the cough worsens. This is how the body tries to get rid of toxins in the lungs. By the way, during the same 24 hours, your risk of developing coronary artery disease decreases. 48 hours after nicotine and its breakdown products are completely removed from the body, nerve endings begin to recover. Resin and other substances negatively affect the taste buds, reducing the number of blood vessels in them. Now they are regaining their sensitivity, and the food gets tastier. However, for many experienced smokers, the loss of sensitivity of taste buds is already irreversible. 72 hours. Withdrawal reaches its maximum. Headache, nausea, cramps, as well as increased anxiety and depression. Similar symptoms appear with other addictions, including caffeine. But after that, the worst is over. After a month, the risk of developing type 2 diabetes, cancer, and cardiovascular disease decreases as much as possible. In the period from 3 to 9 months, the damaged cilia in the lungs are almost completely replaced with new ones, which makes it possible to successfully remove dust and slag. As a result, your cough and shortness of breath are almost gone. After about a year, the risk of developing heart disease as a result of deposits of fatty plaques or scar tissue from damaged artery walls will be halved. After 10 years, the risk of lung cancer is halved compared to those who still smoke. And after 15 years, the risk of a heart attack decreases to the level of people who have never picked up a cigarette in their lives. Of course, this information is not final. The recovery of the body depends on how many cigarettes you smoked per day and per year. Unfortunately, irreversible changes and increased susceptibility to various diseases are always possible in the lungs. Quitting smoking is not easy, but the benefits are much greater than the discomfort. In the end, the best way to avoid this is not to start smoking at all.